Thanks, Aldaviz. Well, as we mentioned earlier, the Ministry of Health has reported 2 newly confirmed cases of COVID-19. This brings the total number of confirmed cases to 49. The newly confirmed cases are a 40-year-old woman of New Providence with no travel history. She's in isolation at home. The second case, however, a 50-year-old man also with no travel history, has been hospitalized for treatment. So far, there have been 7 confirmed cases of COVID-19 in Grand Bahama, 40 in New Providence, and 1 confirmed case in Cat Key, and 1 on the island of Bimini. The death toll stands at 8. Well, with more than 1.8 million confirmed cases of the novel coronavirus worldwide and more than 116,000 lives lost, one local healthcare professional is highlighting the challenges of working during this pandemic and why she and so many others are willingly putting their own lives at risk. Cleopatra Murphy has the story.
For healthcare professionals like nurses serving on the front lines of the COVID-19 pandemic, the feelings are many. Questions over their well-being and that of the families they have to go home to, and also working to serve the good of the nation. Former Bahamas Nurses Union President and registered nurse Chana Khalfani shares her feelings and that of many of her co-workers during the global novel coronavirus outbreak.
You have concerns, firstly, for your safety and wanting to ensure that you don't take things home to your family. You are concerned about your extended family, making sure that they understand that what is happening and what they need to do. And then you look at your country, you look at your people. We only less than 500,000 people. And when you're talking about something that seems as if it is extremely contagious, you're only talking about 500,000 people.
Khalfani says as one of those putting themselves at risk, there are grave concerns that she was not willing to discuss. However, President of the Commonwealth of Bahamas Trade Union Congress Obi Ferguson highlighted a number of issues facing doctors and nurses in a statement, requesting that all healthcare professionals on the front line receive major health insurance, also requesting a meeting with the Prime Minister and Minister of Health to address the problems. He also noted, "I understand that there may be attempts to force some of our healthcare professionals to work schedules that are unfair and dangerous to their health and that of their families." Despite the risk to healthcare workers, Khalfani says they feel a sense of responsibility.
Like I say, for only 500,000 people, and we all know each other, we all have to do what we have to do. And this happened to be the part that I have to play to ensure that we get through this. And that's how I look at it.
While healthcare officials say the country is in the midst of a surge with no timeline of when the country will see a peak in COVID-19 cases, the former Nurses Union president appealed to the public to take the health threat seriously.
That's at least at the end of the day, we have minimal amount of casualties. We've lost a very, very fine doctor in the name of Justin Anius, and we are all still grieving because of that, So please, my people out there, please take this serious, and let's all do what we need to do to ensure that we get through this, and at the end of the day, as Bahamians, we are still standing.
Khalfani also had words for her fellow healthcare workers on the front lines.
Stay encouraged. We have to believe that there is a God who is protecting us while we are doing what we have to do for our country.
Cleopatra Murphy, SNNS Network News.